Good evening, everyone. Today, as we discussed before, we are going to start with our cardiology questions. Just like I said, this is one of the very important question. Dilated cardiomyopathy is the answer for this. I've already told you the answer, but let's just discuss the question now. 34-year-old man diagnosed with advanced non-Hodgkin's lymphoma undergoes doxorubicin containing chemotherapy. That itself says this. It's a dilated cardiomyopathy. If you have know that all the chemotherapeutic drugs ka side effects, then you will easily answer with go with the dialectic automatically. It's a very easy question. Let's just see and apply the logic. Even if you don't know the side effect of this doxorubicin, just see the symptoms and then come to an answer. Let's see that several weeks after the chemotherapy, just see this is also one of the hints. Several weeks after the initial chemotherapy drug, it's not like radiotherapy, he's just saying chemotherapy, and the patient comes to office with a progressive exertional dyspnea. Okay, there is a dyspnea and has a difficulty sleeping flat at night and needs to be used multiple pillows to fall asleep. That means he has an orthopnea. Okay, the orthopnea is there, and the patient is a lifetime non-smoker, no family history of heart disease. See, this itself, no family history of heart disease, that itself rules out the hypertrophic cardiomyopathy, right? It is an autosomal dominant disorder, the hypertrophic cardiomyopathy, which I have given as HOCM in option. That nobody has answered this, but just see, it is an autosomal dominant disorder. That's good that you have ruled out this. Most of the people confuse between the dilated cardiomyopathy and the restrictive cardiomyopathy. I'll just let you know why it is not the answer. And this is the dilated hypertrophic cardiomyopathy is like autosomal dominant condition, which you already know, this beta myosin heavy chain mutation. So that will cause the septal hypertrophy and leads to the cardiac failure, right? So this is not an answer. Then what is this pericardial fibrosis or thickening? This comes in when after radiotherapy or acute viral infestations. Okay, this is ruled out. And then restrictive cardiomyopathy, most of them answered restrictive cardiomyopathy. It is typically seen the infiltrative processes restriction, like the not very restrictive pattern will be seen mostly. This infiltrative processes like amyloidosis, sarcoidosis, such kind of cases we see this restrictive cardiomyopathy. And it is always there won't be dilation of the ventricles as such in this case. So this is not the answer. Okay, this is a doxorubicin chemotherapy ka side effect. It is dilated cardiomyopathy. And RV pressure overload, some of them answered this as an answer. Let's just see why it is not an answer, because RV pressure overload will occur in a acute pulmonary embolism, right? Like whenever there is a pulmonary embolism for a long standing, even malignancy can be the risk factor for this, for a pulmonary embolism. But here it is not it is not a sole cause for this, right? For a pulmonary embolism there are a lot of reasons, but it is just one risk factor. The cancer is just a risk factor for this pulmonary embolism. In that we can see the RV pressure overload, dilated RV ventricles and right ventricles, all that stuff, and hypokinetic dyskinesia will be there. All that is seen in such cases, pulmonary embolism, acute cases. But it is several weeks after the chemotherapy. It clearly says that it is a dilated cardiomyopathy, and we can remember this side effects of this anti-cancer drugs like this. It is from first aid book, this chemo man. It's very easy to remember like this way, so I've given this to you. This and here it is, see, doxorubicin and daunorubicin are the cardiotoxic drugs. These are the cardiotoxic. These are the anthracycline drugs. See, here it is the D. This is the heart D, and even trastuzumab, that is also causes cardiotoxicity. And these are the they bind with the topoisomerase 2, and then they cleave the DNA. To cleave the DNA, and it will stop DNA synthesis. Also, it binds with the iron and to cause generate free radicals, such that it is more cardiotoxic. So these are the DNA synthesis inhibitors, and then free radicals production will be more in this with these cardiotoxic drugs like doxorubicin, daunorubicin, trastuzumab, all this. And see, vincristine and vinblastine are the like poetically they say that vincristine is crisp the nerves and vinblastine is blast the marrows, like that. We just remember this vincristine C V. This is the V of the chemoman. This peripheral neuropathy. So peripherally neuropathy. Bleomycin and busulfan causes pulmonary fibrosis. These are the B's. Pulmonary fibrosis. These also induces the free radical formation and causes the pulmonary fibrosis. And cisplatin, carboplatin, or the paclitaxin, or this stuff these things are cross links the DNA to inhibit the DNA synthesis. Cross linking of the DNA, cisplatin, and this will cause cyclophosphamide nephrotoxicity, especially these are the kidney, and there's also cisplatin and carboplatin causes ototoxicity, right? And cyclophosphamide will cause hemorrhagic cystitis. You know that treatment for this is Mesna, right? Mesna, is it Mensa or Mesna? You just tell me Mesna, okay? Correct me if I'm wrong. I think it's Mesna. And yeah, what else we remember? This is C and this is Y. Cyclophosphamide causes hemorrhagic cystitis. So we can easily remember this. Vincristine, vinblastine causes peripheral neuropathy. Bleomycin, busulfan causes lung fibrosis. Doxorubicin, daunorubicin, and trastuzumab cardiotoxic. The C, cisplatin and carboplatin are nephrotoxic and also ototoxic. And the CY, cyclophosphamide, is hemorrhagic cystitis. So this is about the chemotherapeutic drugs and also this cardiolateral cardiomyopathy. It is very important question as such. There is a pathology question can come with this. Even last year INSCT has this last INSCT has this question about dilated cardiomyopathy. So read about that. And thank you for today. Tomorrow we'll come up with a new question, and take care. Bye.